great session planned for you today. So I'm glad that everyone set their alarms and they did show up on time this morning. So thank you for that. We just want to get started by acknowledging the original stewards of the various lands that we are on. We also want to acknowledge our ancestors and all those who toiled without compassion or compensation. We acknowledge all the elders and community stewards whose shoulders we stand on as we build, share, and learn together for our collective liberation and sovereignty. So again, welcome. Thank you for coming. We have a phenomenal panel here today. I'm going to have each of them introduce themselves and let you know the origin of their organization. So our brother Paul, if you want to go ahead first and introduce yourself and your organization.
All right, I'll give it a go. Good morning, everybody. My name is Paul Bailey. I'm the executive director of the Black Health Alliance. Black Health Alliance has been around for about 20 years, really as a grassroots convening organization aiming to improve the health and well-being of Black people, African people in Canada. More recently, we've kind of turned our attention to focusing on some key issues that we've heard from community: mental health, longstanding health inequities related to chronic disease, longstanding issues as it relates to the social determinants of health, so things like housing, income security, food security, and early childhood development. All with the aim, again, of driving our mission, which is to improve the health and well-being of Black people in Canada. I'll leave it there for now.
So good to hear. Thank you. Very important work. Abena, can you go ahead and introduce yourself and your organization?
Yeah, so my name is Abena Addo. I'm the executive director of the Black Healthcare Professional Network, which is a subsidiary of Aspire for Hire. So with the Black Healthcare Professional Network, we launched in October 2021. So we've just been just over a year working, and our goals are to support Black healthcare professionals in Ontario. And so we do that by providing mentorship, networking opportunities, as well as business advisory services to support Black healthcare professionals in starting their own business. A lot of times in healthcare, you go to school for 10 years, you become a physician, a dentist, physiotherapist, but you're never really taught about how to start your own business. And the nature of the work is that healthcare professionals are their own business, often contracted out to different hospitals, different clinics, et cetera. And so we provide that critical infrastructure around business so that healthcare professionals can begin to understand how they can actually improve their profession by becoming their own entrepreneurs and starting their own businesses.
That's great. Thank you for that. Really appreciate the work that you're doing for our healthcare professionals here. So my first question for both of you is, what are the most promising models in healthcare work that you've seen thus far in Canada? And we can start with you, Paul. Go ahead.
That sounds like I've been a question. What are the most promising models of healthcare? I honestly don't know how to come at that question off the top of my head, but the stories that I hear on a daily basis are stories of folks not getting access to the kind of care that they need, not getting treated in those healthcare environments in the way that they should be treated. So, experiences of anti-Black racism or Black women not being listened to, folks who are living with sickle cell being looked at as drug seekers when they're going in for care in crisis, a whole range of other stories in that context. And so, it's in that context that, organizations like ours, Black Health Alliance, organizations like the Sickle Cell Association of Ontario, and longstanding, stalwarts and folks in the community. I think even Victor was involved back in the day, pushed for the establishment of something called Taibu Community Health Center in Scarborough, Ontario. And Taibu's mandate, it's a community health center. Its mandate is to serve Black communities in the Greater Toronto area from a culturally responsive and safe, angle. So, imagine hopefully an environment free of that kind of anti-Black racism or discrimination, et cetera, that people will face. And so I think the answer to the question is we have worked, our organization and people in the community, to um, create the kinds of models that resolve sometimes trying to build your own institution. I think the last thing I'd say there, it's an interesting case because oftentimes we think about building our own pieces and things, and we think about doing that outside of government. But it's a story of folks in the community pushing to hold government accountable to pay for what we all deserve as taxpayers here in Canada, pay for a model that would respond better to our needs. And so I think, when I think about a promising example, that's it.
I appreciate that. Very valid points. Thank you for sharing. How do you feel?
I'm in alignment with these like Taibu and other community health centers that are focused around Afrocentric models and actually supporting different communities for their unique needs. I think, Canada is so diverse and each group has specific needs for how they access healthcare, what they need from healthcare, et cetera. And I think it's really important that there's models that allow that to actually happen. And so, a lot of these community health centers that are Black focused or, organizations that are supporting the Black community are helping with that. I think in Canada, obviously our national health care system model is, better than some other countries. And I think the next step to improve it or help it is to make sure that we have like a full ecosystem. A lot of times healthcare professionals are isolated. Like I said, they might be contractors for different hospitals, different clinics, and they might have things that they learn or they think could be improved, but because of the nature of their working almost in silos, that's not always heard. And so I think having networks and opportunities where healthcare professionals can all come together, work with one another, improve efficiencies, et cetera, is kind of how you take it to the next level, because we all know healthcare is holistic. There are so many different aspects, and preventative healthcare is an important thing as well. And being able to kind of work with a bunch of different healthcare professionals to give the whole holistic model of improved health around the country is kind of something I think we need to work towards. And a way to do that is just mentoring, networking, and creating opportunities for people to share their feedback and experiences on the system from both, a practitioner's standpoint, and also community standpoint.
I appreciate that. Thank you so much. Now, for Paul, I know the Black Health Institute has developed some remarkable reports and research. So due to the COVID-19 pandemic, are any other narratives that you have heard that have impacted the Black community specifically?
You mean specific to COVID-19?
COVID-19 in the Black community.
So, we haven't authored the report, but there's a report from StatsCan that basically, said in the peak of the pandemic, Black people in Canada were disproportionately impacted by mortality or death. The actual number one group, 49 per 100,000, versus if you looked at the white community, 22 per 100,000, so almost double the amount of death. And I don't think that story gets told enough. So our work has been to engage communities in a conversation about like overall wellness, but also the importance of things like vaccination in that context, particularly if you're living with diabetes and hypertension and a whole bunch of other conditions and concerns. So what we're hearing from community now is, if I'm honest, nobody's really talking about COVID-19. It's not really the thing that folks are focused on. Many more folks, I think, are invested now in a conversation about like overall health and well-being. And again, like Abena mentioned, like some of the work that the community health centers do. Folks have been, really trying to create the opportunities for folks to get, access in the communities, that they're in. I would say what we know will be the fallout from COVID-19 as well is, pre-pandemic, we know that, Black communities were, facing barriers already. So the things like preventative screening, cancer screening, for example, often called like the underscreened or never screened. And so the impact of the pandemic on on those pieces are going to be significant for Black communities. And so, many of us are thinking the double barrier. COVID locked all of that kind of testing down. We know that we were under tested before. How do we make sure that our communities have access to, that kind of important care, and in an environment that's going to be, positive and affirming and support folks throughout the process. That's what comes to mind.
Appreciate that. Thank you so much. Abena, in your lived experience in healthcare, what do you feel are maybe some best practices that are essential for racial equity in Canada?
I think best practices, I would say something that I've learned, I guess, in my lived experience, but also in the work that I do with mental health and the Black community, especially Black adolescents, would be the importance of training models or service delivery models that have practitioners or people delivering a program that are also have a lived experience or share the same cultural identity. So in a lot of the work that we do with young kids, it's really important that the mental health practitioner is also Black or has a lived experience. And there's a lot of stuff that doesn't have to be explained. So we know the Black community is less likely to, they have high incidences of mental illness, but are less likely to access care for mental illness. And a big factor in that is because you're not having access to practitioners or people that look like you who are supporting you, teaching you, and helping you overcome that. And so I guess the best practice would be having, improving access to these practitioners so that we can actually feel the impact of the different interventions that are happening. Yeah.
Appreciate that. Thank you. Paul, as it relates to structural racism, anti-Black racism, systemic discrimination, what do you feel are the best practices or tools or models that you've seen that are actually working to advance the healthcare system here in Canada?
You guys are hitting with the questions this morning. Honestly, I don't know if I've seen a best or promising practice. I think, healthcare is a really violent space for Black folks, based upon the stories that I've heard. And literally, again, as I say, like, we get these emails and we get these calls on a day-to-day basis. And when you layer on, other things like gender or sexuality and, those kind of things, disability, etc., it gets worse and worse and worse and worse. I think there are more folks, and it's not necessarily coming from like institutions in and of itself. It's often like fearless warriors inside healthcare institutions. Hopefully sometimes those folks are unionized so their jobs are protected, who bring us or bring the community like the issues that they're seeing on the inside. And with that information, with better insight, with a better understanding of the things that patients or clients, etc., are experiencing, you can kind of work as a community to address those issues and leverage folks to who are specialists in this area. So I think of like folks like Kika Ojo, who's from the Kojo Institute, who's doing some work at CAMH right now, in forensics, training and working with staff to address things like over restraint, so like physical restraints or chemical restraints, etc. And so like the work is never linear. I think it's there's a roadmap. I think there are many of us who are in the space and trying to figure out what the right way to keep the pressure on. But I think the thing that I think is important in that context is like this work can't be done from the side of our desk. Like it needs to be somebody's job, if you will, and our community has to support those jobs, if you will, to hold these people and things accountable. Again, while we continue to try and build, the next Taibu or the next, mental health services that's responding, better to the needs as Abena just mentioned. But I'll leave it there.
Thank you so much. Yeah, we had Kika on I think last week, and she is doing some phenomenal work. So thank you for sharing that. Abena, how do you feel on the same topic? what practices are actually advancing the healthcare here as it relates to systemic discrimination and anti-Black racism?
Yeah, so I have to agree with Paul that I don't think there's any like amazing model that is currently being used that I would want to continue. But I think something that really, I think, has fast-tracked or, you know, really made people start to listen is data collection. So actually having data to explain, you know, a lot of us know from our lived experiences, like these are impacts that our community has. And unfortunately, I think for the last few years, it's been challenging for us to have a lot of data. I know Black Health Alliance has amazing reports, but I think the more and more reports that are coming out, the more and more people who are collecting data on the Black experience, the more we can actually use that as a tool to go to government and go to different officials and, you know, require them to fund these issues. You know, my organization, we received some funding through the Mental Health of Black Canadians Fund. And one of the biggest takeaways from learning from all the different people in that group was that there just wasn't any data to explain what we all know. And as a result, it's like, well, we don't actually know what the challenges are around mental health for Black Canadians, right? And then that's just like Black Canadians. And if we talk about the diversity of Black Canadians, you know, there are people who have very different experiences, people who are immigrants, people who are first or second generation, people who, you know, are biracial. There's so many people who have different experiences. And then if we add in LGBTQ+, you know, these are all different things. And right now we don't have data to understand how each group is impacted. And I think the more and more data that we can collect, the better. A second thing around data would be, you know, having data around our healthcare professionals as well. You know, Canada doesn't have race-based data relative to our neighbors in the US. And, you know, having that information is actually really helpful to help explain the gaps. And now, you know, with BHPN, we're supporting and getting race-based data from all of our health practitioners, you know, like where do you identify? What languages do you speak? Where do you live? Where do you work, right? So now we can actually have an idea of all of the people who are involved in health who can support the Black community across Canada, because there's so many unique challenges of people who might not have English as a first language, et cetera. And so being able to have data to really support that, I think would help elevate and take, you know, the needs that we have to the next level, because we'd be able to get more funding and programs, et cetera.
Thank you. Now, you just touched on research that needs to be done. So in terms of like, you know, justice, access, equity, and inclusion, diversity, are there any health practitioner frameworks or individuals that inspire you where you see this work is being done?
I mean, Black Health Alliance and Paul, you guys are doing amazing work in getting a lot of this data published and in readily digestible ways so people can actually see what's happening and it's like, take a look. I think another thing that could happen is that there's a lot of Black healthcare professionals who do this work on the front lines. And, you know, a great example is the vaccination clinics that happened across Canada. There's a lot of Black doctors going in and supporting the Black community with getting vaccinated, right? And that was a very effective program. But I think there's a lot to have learned from that. And I'm not sure that the voices of the Black healthcare professionals, like, yeah, they came in, we increased the vaccination rate for the Black community, but I think there's a lot of other lessons learned and, you know, things that could help improve access within the community to healthcare, et cetera. And I think, you know, giving opportunities to amplify the sound and the lessons learned from these practitioners is important, right? A lot of times they go and do their work and then they go home and they don't really have, you know, they're not necessarily involved in nonprofits. They're not necessarily involved in equity work. Like that might not be what they are, you know, interested in per se, but they have a lot of knowledge. And I think it's important for us to really amplify their lessons to actually understand what's going on in the front lines.
Absolutely. And Paul, is there anyone in this area that inspires you as it relates to, you know, equity and inclusion and diversity?
I think it's something that the way that Abena said it made me think about like what's possible. So like from my vantage point, I see a ton of folks literally across the country and actually other parts of the world, but like what comes to mind here locally is, you know, folks like Dr. Aisha Lofters, who's doing work around like Afrocentric models for breast cancer screening, or Dr. Oni Noram, for example. But there are a ton of doctors. Dr. Cindy Maxwell, who's OBGYN and like really like highly specialized in folks who face complications around pregnancy. But there's a ton of folks doing, amazing kinds of things. A ton of professionals that we don't know the names of that are every day in their practice, like doing novel things. Like somebody told me the other day that, they're a nurse in like a hospital, or like a nurse practitioner or something like that. And by like the vantage point of where they sit, they happen to see a lot of Black women coming in that need ultrasounds. But because she knows that there is like a disproportionate rate of like, for example, uterine fibroids or things like that, she automatically makes sure that folks get screened in a way that the protocol doesn't call for. So I'm saying there's a lot of folks that are doing these kinds of novel things, whose names that we don't know, but like I think that reinforces the point around like the need for that ecosystem, the need for the gathering, the need for understanding what people are seeing and doing. But those names that I call are some of the folks that I look to every day.
Definitely a lot of heroes that people don't know and their names are not in flashing lights. So thank you for shedding some light on that. Abena, this next question is for you. Many of our healthcare professionals here nationally and internationally have raised awareness around rest being a form of resistance. So you as a leader, how essential do you feel that self-care is to your well-being and the work that you do?
Yeah. I've been a mental health advocate for as long as I can remember, and something that we're learning about all of our healthcare professionals who, were in the front lines during COVID is that mental health, like, these people are burnt out. And, we're facing the double sword, right? It's like, okay, not only are you a frontline worker, but you're a Black frontline worker. And now it's like, well, we have to convince the Black community about vaccination. And there's just a lot of burden that went on healthcare professionals, which had already happened before. And then COVID exacerbated it. So a big need that we see within our healthcare professionals is supporting them with mental health services. And again, not just any mental health services. We want to support them with people that look like them. So we want to have mental health practitioners that can support our Black healthcare professionals in a way that's actually meaningful and effective. And so, yeah, I think it's super important to make sure that everyone's taking that needed time, especially outside of COVID. And for myself, it's something that I definitely incorporate within everything. I have my morning routine going on, and I'm really trying to stick with it and make sure that, having a healthy self is how I can actually, support the community and others that need me. And I think it's really, really important to acknowledge that and understand that. Being, overworked and all this stuff, it's something that happens, but I think prioritizing yourself is something that, I've been an advocate for. And that's something that I make sure with all my team and all the healthcare professionals that we're working with. Like, that's the first question I always ask, like, how are you doing today? And I think a lot of times we forget how important it is to just kind of be honest about what's going on in our lives and other things that are going on, and being sure that we can prioritize our own health and care.
I appreciate that. Thank you. Paul, how do you feel on this, the importance of self-care?
Yeah, the thing is, I think we all know the importance of self-care. I would hope that we all know this, but I struggle sometimes with the practice. I'm not, it's by no means like trying to be a hero or anything like that, but there is so much to do, so much to build. So I'm, if I'm honest, I know and I think it's important, but trying to find the right ways to practice. But I have some good examples from some of the folks on this call, so I'll lean on them.
Okay. This next question is for both of you. What types of funding and resource allocation do you feel are required to scale the work that you do? Abena, we'll start with you.
Yeah, I think more funding, to be frank. And the thing is that I think every time we get a project, we submit a proposal, we get some funding, we have so many things that we learn as we're doing the work, getting to know people, understanding the actual challenges, that new challenges are that we never even thought of, we're learning about. And so it really speaks to the need to get additional funding to support these ones. Like the example is the mental health for the frontline workers, all the healthcare professionals that we work with, right? that's not something that we thought about when we were supporting them in starting their own businesses. It was before COVID, and we didn't know that they were struggling with mental health problems. And so now it's like, okay, we need additional funding to actually support our entrepreneurs in being successful, because they need extra support, because they have had all these challenges during being a frontline worker throughout COVID. So I guess my call to action is just kind of making sure that, funding doesn't stop at a project completion date, and understanding that there's actually a lot of different pathways that a project can go, and it unveils a bunch of different challenges. And I think it's important for funders and government and everyone to understand that as we go, like, there's so much that we don't know, that as we go, we're learning more and more. And it just speaks to the need to actually have that holistic view. And there needs to be more funding pumped in to allow us to actually address all of the challenges that we figured out as we started a project.
More funding, always necessary. Paul, how do you feel on this?
Yeah, I would echo all of that. What we're focused on the Black Health Alliance is, like literally at the moment is a lot of work around business model. So we're a charity or a nonprofit, but at the end of the day, like, government isn't going to pay you to like lobby them or hold them accountable, right? So, we've been fortunate in the last little while, like a lot of folks, probably folks on this call as well, so thank you for that. But a lot of folks have supported us in the last 2 years, but we know that that's not going to be sustainable. So more funding is needed, but we're putting our emphasis on business model, so that we can, we'll continue to rely on donations, we'll continue to rely on, grants, but we'll also, focusing the way that we drive our mission in really, really key ways. So, if one of the things that we're trying to lift off the ground is the idea of being a knowledge hub. And so that involves, doing exceptionally good community-based research and being exceptionally great at engaging communities. And that's a skill. It's something that's difficult. It's something that's hard. And a lot of folks, sometimes folks looking to build new projects to better serve community struggle with the community engagement side of those things. And so I don't mean to go like too deep into a rabbit hole, but, part of the way that we're looking at our work is whether we're doing training or coaching in a healthcare environment, or whether we're doing community consultations, are these opportunities for revenue generation to again, like, support, better application of the work that we're trying to do. And, in that kind of focus on business model, we're trying to build a bit more sustainability in there. More funding is great, but I think, or is needed, but I think, particularly for the work that's not like client facing, we have to find like much more creative ways of sustaining the work.
I appreciate that. Thank you. Paul, I know you are part of the unfunded report, and that report was groundbreaking. What are your thoughts on how to sustain the momentum of funding in Black communities? What we can do on both sides?
This is probably more of a kitchen table conversation, to be honest. So I'm not gonna give the kitchen table answer. I think the thing that focusing on, like, what is your business for a charity or for a nonprofit, it gives you clarity about what you're going to do and what you're not going to do. So you're not just jumping all over the place for grants or for corporations, etc. You get some clarity with what your how you're actually, like, what's the strategy behind how you're actually going to drive your mission. And I think with more of that clarity, the ecosystem actually becomes clearer. And so I think in order to sustain that work, we're going to have to be able to articulate what we're trying to deliver and what we serve in the ecosystem. And with that clarity, there's oftentimes where, like, somebody gets approached by a funder, or somebody wants to support and give money, or there's an opportunity to pitch and make an ask, but it's not right for them, but it's right for us because we've developed a little bit of that clarity, and folks can call on us to take up that opportunity, and vice versa. But what I'm saying is, I think there's a lot more work to be done to kind of build this ecosystem that we're in, like build and grow and strengthen charities and nonprofits, and the clarity in that. And I think in that comes, the ability to make stronger asks. And I think, also comes the ability for us to make sure that we're putting the right opportunities in the right place. the thought isn't like perfectly clear, but oftentimes we're not talking about like the amounts of money that we're talking about are like incredibly small. Like sometimes we're talking about $250,000, $250,000, $500,000, etc. And like I think we have to understand like the size and scale of the problems that we're up against, like as charities and nonprofits. Like the kinds of asks that we should be making is 50 million, 100 million dollar asks that sustain our work. And I know like sometimes that sounds wild, but like seriously, right? And so I think to make those kinds of asks, again, like that clarity, that business model, the efficiency and instruction, trust me, like many folks are doing this work, are doing amazing work. I think is going to be key to drive those things. That's what comes to mind for me, at least.
Appreciate that. Very well said. Abena, any thoughts on that?
Yeah, I think that's really important, and I think having, the bigger asks is huge because, as I mentioned, there's so many things that we try to do with like 200K. And, a lot of times the government or whoever's putting these calls out, they're asking you to fix every problem and the grant is like so small. And so I think it's really important to make sure that, we're the experts around healthcare in the Black community. So we need to let people know what it's going to cost or how big the actual problems are. As Paul mentions, like this is like $1 million question, not what you're offering. And, being able to have the data to support that and being able to really articulate that and, get the asks that we need is important. And I think around the sustainability piece, that's huge. A lot of stuff that we're working for is, looking at sustainability in the long term when all of the funding is exhausted and making sure that we have business models that will allow revenue generation, that will ensure that all of the great work that we've done in the past few years is actually continuing and not just hard stop when the funding ends, which a lot of times happens. And so being creative and understanding how we can, move our business to create revenue is a really important question that I think all organizations, charities, nonprofits, everyone should be asking themselves, like what part of our like if funding stopped for the Black community today, like would we still be here? And it's an important question to ask, like how can we sustain our operations? So yeah, those are my thoughts.
Yeah, sustainability is huge. And with that, this next question is for both of you. As leaders of, Black-led, Black-serving, Black-mandated organizations, what legacy do you want to see left behind for both of your respective organizations? We'll start with you, Paul.
Question much. I think right now we're focused on like how do we deliver results, and what are those results look like for different parts of the community, because different parts of the community have different needs. I think if we're successful at listening to folks properly, we're successful at gathering the information and the promising practices, whether they're from here or there. I think the legacy would be hopefully one of results on a number of things. I know that sounds vague, but that's what's coming to mind.
Results is important. That's a good legacy to have. It could definitely be negative. So results is still a positive legacy. We appreciate that. Abena, what do you feel?
Yeah, that's a big question. I think I'm in agreement with Paul. Like I'm really focused on actually understanding what the challenges are and figuring out ways that we can actually address them in a sustainable way. And I think if we can do a good job articulating understanding what the problems are, articulating that, amplifying that, making sure that it's well known across the country, like that's an amazing thing. And if we can support the Black community in elevating and getting out of all of these challenges that we face, that's great success. And I think just making sure that we can actually get a holistic view of what's going on is what's more important to me, because every time I go into a meeting, I learn something new about things that we need to do. And yeah, so with the results, I would be in alignment with Paul with just making sure that we can actually help change the narrative for a lot of challenges we're experiencing as a community.
Delivery is important. So we appreciate that you guys value that. This is my last question before we get to call to action. What do you feel the future looks like for Black health policy here in Canada? Paul, we'll start with you.
The future of Black health policy. So I'm seeing the current impacts of folks that are living with chronic conditions. I'm seeing the impact of, again, like disproportionately poor outcomes across social determinants of health. Just read something in the chat from Mahat, I think, around environmental racism and how that's affecting our communities and health and well-being. We tend to not talk about it a lot in Toronto, but like really being talked about it a lot in on the East Coast and in Nova Scotia in particular, with folks like Ingrid Waldron and stuff like that, doing some of that work, talking about climate change and the impact of like living in a literally like concrete jungle, climate change getting worse. You know, some of the newest buildings that have been built by our city, which, you know, a lot of Black folks live in, have no AC, have no balconies, you know, all of these kinds of pieces. And so what does this mean? What does climate change mean for people's health in cities, particularly poor and racialized people, et cetera? And so I think to the question, I'm seeing all of these issues, and I'm struggling to think and try and build a framework that understands how to kind of prioritize and where we should be directing our resources to address those pieces. But I do know, like, looking from the work that folks are doing across the country, and again in other parts of the world, you know, continent and otherwise, you know, there are solid examples about you know, what we can do to deal with things now that hopefully changes the trajectory and not changes the future, but, you know, creates a brighter future where folks are, you know, healthy and well and thrive.
I appreciate that. Abena, what do you feel like the future looks like for Black health policy?
Yeah, that's a big question too. I think, I mean, from my point of view, we're kind of focused on the whole race-based data with healthcare professionals and understanding, you know, who is who, where they live, what they do, how they, what languages they speak, et cetera. And so we're really trying to push to make sure that we can get this data, like with all of the different institutions that all of these healthcare professionals are a part of, and making sure that, you know, we can actually have this disaggregated data to understand the unique challenges that Black healthcare professionals in Canada experience, not only with entrepreneurship and business, but just in their everyday practices. So making sure we are really trying to penetrate health policy by changing the narrative and requiring certain data collection with, you know, anytime someone graduates or gets their license, et cetera. So that's what I would say I see for the future with health policy.
Thank you. I know earlier you touched on the call to action for government. What do you feel is your call to action for healthcare communities across Canada, Abena?
My call to action for healthcare communities, I mean, I think groups that are in healthcare and this equity space are working to really try to amplify the voices of Black healthcare professionals. But I think what everyone needs to understand is a lot of times, like, they're doing so much work, right? Not only are they in the front lines doing their jobs, working at the hospitals, but we're also expecting them to explain all of the lessons that they've learned, you know, how they can better support the Black community, all the preventative things that we should be doing in the Black community. And so I think it's important for us to give these healthcare professionals and the healthcare community a platform to actually amplify their voices. And, you know, they should be compensated for this work too, right? It's not just like they should be having to tell everyone everything that they've learned. We need to be able to give them, you know, and a perfect example is the consultant that works with us. So he's a doctor. He's been working for 5 years in Canada. He has no idea, he's a Black physician, but he doesn't really work in this equity space. He doesn't necessarily know what the problems are and who's trying to solve them. And, you know, he started by going and doing these vaccination clinics in the Black community, and that helped him really start to understand how he could support and give back. And that's when he learned about different organizations, and he's working with us to make sure that we're changing the narrative for everyone in the future. So I say this to say that we need to give these people a platform and, you know, not take away from their livelihoods. Like they need to work, but we need to give more people a platform to be able to share the wealth of knowledge that they have being on the front lines. And that's not just making them come after work and speak or start their own organization. Like, we need to compensate them and allow them to come and amplify their voice. And I think they have so much knowledge that is yet to be unleashed, and we can learn a lot from them.
Appreciate that. Thank you. Paul, what do you feel is your call to action for the healthcare communities across Canada?
I think there's so many, but I think we have to understand, like, also that I think it's one of listening, like listening deeply, right? So, oftentimes folks in healthcare, and like my background isn't in healthcare, so it's not a criticism, it's just like the perspective is folks in healthcare, they're trained a certain way, they're trained to think a certain way, they're trained to value certain ways of doing, I'm particularly talking about like, physicians and like Western medicine, etc. There's value there, but I think, oftentimes it's approaching communities as if like we're the experts about what's needed, what people need to do, and how things be structured for folks. And I think we need to, flip that and reverse it. I think it's important to take a step back sometimes, sit down and listen to what folks are articulating as those needs. And sometimes in the complaints, or sometimes in the cussing, or sometimes, not in that, are the solutions, folks identifying the things, that they actually need to be healthy and well. And I think, to Abena's point around the vaccine clinics, and one of the interesting things that, we've seen over the last little while is so some folks in the community were calling for like greater access to vaccinations, specifically like locally in their communities, and folks mobilized to do that. But folks started to also like name other issues. They were naming that like COVID-19 and vaccination wasn't their top concern. Their top concerns were things like food security and housing, and like the existing health problems, that they had. And so with more health leaders, community health centers, etc., listening to those needs from community, like we've actually seen a flip of the way that those clinics are organized. They're more wellness clinics, if you will, that bring in naturopaths, that bring in folks who deal with the social determinants of health, that bring in folks who kind of work in the diabetes and hypertension space, etc., that allow for just a like more holistic look at what communities need. And you can see like folks who wanted to get vaccinated got vaccinated, and like creating more access did that. But you can see like the strong uptick of like folks across like the age groups in how like the communities responded to those wellness clinics. Like people come out because it's meeting some of those multiple needs. And so again, like that listening, I think for me is the biggest call to action, and then we can mobilize our strengths to try and meet those needs as best as possible.
And you actually just touched on, listening to the Black community, and sometimes in the complaining and the cussing, we need to hear what they have to say. So what do you feel is the call to action for the actual Black community? What do we need to rally together and encourage them to do? Paul.
You go first, Abena.
Okay.
So what do we need for the Black community to do? I mean, I don't think we need to put pressure on the Black community to do anything. Like, we've had all of these experiences. Like, I'm talking about like general population. Like, I don't think it's unfair. I think we need to create more spaces for their voices to be heard, and we need to understand, collect data. Like, we do a lot of data collection with our professionals, with our adolescents, with our staff and young people. And I think we just need to keep creating opportunities for them to actually be able to articulate. And, it's important that we do the work, because we can understand what they're saying through the cussing and all of this, and actually make sure that that gets translated into a result or an action that we can work on to improve. And that just goes to Paul's point, like listening and understanding and creating more opportunities to do that, right? Like, vaccine clinics shouldn't be the reason we're understanding that there's a housing shortage or food insecurity, right? And so being able to go out in community, understand the challenges, and give them a voice, and take that voice and allocate an action to it. And, where are the people who can do that? I think that's what's most important. I don't think it's anything that we should be putting pressure on the Black community to do specifically.
Interesting. We have heard that in other answers this month as well, that the pressure is not on the Black community. So I really appreciate your answer. Paul, do you have any thoughts on that?
Maybe just because sometimes I'm a contrarian, I'll take the opposite view. I think I think the pressure is on the community, to be honest. I genuinely believe nobody is coming to save us. And so it's important that we we take our health in our own hands to an extent. So by that I mean, like, I'm not saying like one government and we're not going to work with government, etc. At the end of the day, like, we're taxpayers in like a place like Canada, and there's an accountability to our needs. But like, for me, it's like the order of events. And I think there's power in the community coming together to articulate through a common voice, what it needs. I think the nuance of that, though, is I think there's a greater responsibility, less on folks who are kind of going through it every day. There's a greater responsibility for like the Abenas and the Pauls too, and like y'all have already done that. It's like for us to reach out to each other and figure out how to connect and align, our work, like us taking the responsibility to build that ecosystem, I think is the thing that applies to the Black community. Like, there is a growing ecosystem, like right across the country, of organizations and professionals and people. And I think for people like us, whose job it is, if you will, to do this work, we need to figure it out.
Appreciate that. Thank you for that spin. I really appreciate both answers. Abena, do you have any final closing thoughts that you want to share?
I guess I'll go back to the last question a little bit. I guess I'm not trying to say the Black community isn't responsible for their own health. I think that that's clear and definitely, but I think a lot of times we put this pressure on people who have no idea, and we're trying to say, well, you need to tell us every problem that you've had, and you need to go make sure that it's getting fixed, right? I work with a lot of Black youth. I work with a lot of Black young people, and like, they don't have a platform. They don't know what you're talking about. They don't know what they don't know, right? They don't really even know what anti-Black racism is. And we're trying to explain to them, well, all these stresses that you've had because of how you interact with authority and how you've been treated at school your whole life, you need to know about it, and you need to go get a therapist, and you need to make sure, like, they don't know that. And I think education is important to help the Black community understand the challenges that they're facing, that they might not have a word for, or they might not be able to describe, or they describe it in a way that a regular non-racialized healthcare professional might not understand, and actually educate them on what challenges they might be experiencing. We see this in mental health all the time. So that's what I mean. And I think it's important for Black-led organizations and people focused on health to be getting that information and, giving education and helping to empower the Black community to actually go out and be advocates for their own health, because we are very far behind. A lot of people can't identify what's going on, or there's a lot of cultural challenges where, mental health isn't a thing. So how are we supposed to be going out and seeking it, right? So I think making sure that we're educating and supporting the Black community to be advocates for themselves, to actually be in a position to go out and be responsible for their own health. And just my closing remarks, I would just say, I think it's important to keep having conversations and discussions like this around health in the Black community. And I think, this is just the tip of the iceberg. There's a lot more work to be done, a lot more research, and we just have to keep creating the ecosystem, strengthening the ecosystem, having conversations, having difficult conversations. And that is the key, I think, to moving the work forward and seeing the results that we all know are coming.
Thank you so much for adding to your answer. Paul, do you have any final closing thoughts you'd like to share? You're on mute, sir.
I thought I was going to be amazing at that. I think Abena said it beautifully. For me, we're dealing with this every day. We're dealing with different pieces of the work every day. And I think, to all the folks on the call, thank you for coming out. We all have an individual role, whether it's for our own personal health or for the collective health, if you will. And I think the work that we're trying to do at the Black Health Alliance is to amplify and to edify and to support that piece of the work. I'd say, thank you for this space, Blessed and Victor, because I think it's like in the convenings, it's in the listening and the engagement where we start to, understand the places for connection and to, build those coalitions of support. That's like, these are the spaces, these kinds of conversations where we can figure out, what each other's doing and where the problems are and, where there's the opportunity to mobilize solutions. And so I look for more of those spaces and the opportunities, again, to draw those connections and to keep it moving.
Thank you
to
so much.
close.
Appreciate that. We want to thank you, both of our panelists. I really enjoyed the dialogue today. It was very insightful. Also want to encourage everyone to sign up and register and tune in tomorrow, where we'll be actually talking about Black communities and charitable status here in Canada as we talk about growing the ecosystem. I encourage all of you to tune in for that. And in the spirit of African excellence, we started on time and we are ending on time with some time to spare. So I want to give all of you the rest of your day to prepare for what you have to get to and work. We just want to close the way we started by acknowledging the original stewards of the various lands that we are on. We also want to acknowledge our ancestors, those who toiled without compassion or compensation, and acknowledge the elders and community stewards whose shoulders we stand on as we build, share, and learn together as we grow our ecosystem and collective liberation and sovereignty. Thank you so much for tuning in, everyone. Have a great day.